Can you tell our audience out there a little bit about your services? We understand you have a medical center that you do regenerative medicine in general, right?
Yeah, basically what Regenestem is about, we are a company that works with patients from all around the world, and we find the right fit for them depending on their ailment. We evaluate them, and we find the right doctor for them that will fit their ailment to perform adult adipose-derived stem cell procedure on them.
Okay, great. And what is, I understand you guys have treatments for adults' impotence? Or is it impotence, or is it just erectile dysfunction?
Absolutely. We have procedures that work with erectile dysfunction, hair loss, and general anti-aging.
And it's being done very successful across the United States by certain clinicians that are very, very experienced on it. And I understand some of the physicians that work for you guys they've done this for a long time, and they're very experienced.
Absolutely. We work with physicians that are experts in their area. We work with Dr. Juan Castillo, who's been doing cellular medicine now for the past 3 years, and he's dedicated himself to that. And he's actually opening up a center in Cancun, Mexico, and we're doing our first cases down there actually in the middle of April.
Excellent.
We're doing some. We have about 4 cases of children.
With autistic
children, and we're doing some pretty innovative.
Watching the Arthritis Show. Joining us in our studios today is Mr. Ricky DeCubas and Mr. Benito Novas. These gentlemen are part of a big regenerative center that is now offering, essentially for all kind of ailments, cell therapy using adipose tissue. And one of the treatments that I've seen this adipose tissue work very well is COPD, or chronic obstructive pulmonary disease. And one of the reasons that it works very well is when they put the cells inside your body, of course they put it through one of your veins in a drip, and this is called the first pass effect. So the first place that this cells would go is directly to your lungs, and over there they start working. So that seems to be very promising. We see reports of patients who were on oxygen or on prednisone for a long time, and they were able to wean themselves off and come off. What is the success rate on that? Do you guys have any?
Oh yeah. Basically, with pulmonary patients, it's almost 100% improvement. I mean, we cannot, at this point, we cannot guarantee any type of percentage. But all of the patients have seen some improvements on the PFT.
Because it goes directly to your lungs.
It is. It
doesn't miss anything.
Yeah, it's actually a direct procedure.
You're right. If these people, you can, let's say, get them off of the oxygen or get them off of the prednisone, my God, that's like godsend. That's huge.
Yeah,
okay.
Exactly. Even in some cases, they drop it all together on the oxygen, or they get half the dose that they were getting before the procedure.
That's it. All right. This does bring us to the end of our show. Any last words from you, gentlemen?
No, just thank you very much for having us on the show, and anybody that is looking for any guidance, please look us up at regenestem.com.